Hello, I'm Ken. Professionally, I'm a medical x-ray technician. I am not a physical therapist, but the information I am giving you comes from a PhD physical therapist who is very reputable and has done incredible work with me. I had back pain for 3 months after a total hip replacement. I couldn't go back to work with that pain. She had me back to work within 3 days. So this stuff hopefully is going to help you. I'm not a doctor. I'm just passing on what was given to me, and it has worked for me. Okay, devices that you may want to buy. If you want a massage device, Theracane is popular, and you can hold it in different ways and massage what you want. You can look it up on YouTube to see how to use it. A strap for doing hamstring stretches, other stretches. A strap about 1 inch webbing, about 7 feet long. You're going to have a loop in the end. I made this myself. If you want to be fancy like the store-bought stuff, you can have a handhold. Doesn't matter. Okay, so I would buy that probably from Amazon. There it also comes with a pamphlet on different stretches. That'll be helpful. While you are buying that, order some stretch bands. The color indicates the tension. Green is stiffer, blue less stiff, and it goes on down or up from there. Okay, the two primary exercises, stretches for your back are the hyperextension and the bridge. For the hyperextension, I'm going to get on my stomach and I'm going to be pushing the top part, my shoulders up. Do that for 20, 30 times, whatever. Then I'm going to act like I'm reading a book, supporting myself at my elbows. I'm focusing on pulling my back in. I want to be as hyperextended as I can be without pain. It's my opinion that this is going to push discs back in place. Could be wrong, but if it doesn't hurt, boy, it might really help. Okay, then the third thing is to do like a push-up, being a little more aggressive. Now, that was the hyperextension. The bridge is the second item for the back. You're going to be flat on your back, feet on the floor, shoulders on the floor, and you're simply going to be raising your pelvis, like so, as high as you can. You're going to keep doing that for 20, 30 times. Basically, the more the better. An incidental thing, maybe it's because of my hip surgery, but I really had some hip pain following the hip surgery. And a piriformis stretch, let's see, they were saying if I'm laying down, is the right hip, so I'm pulling my leg up, and as needed, it could be up this way, it could be in this way more. I can do the other hip. More recently, my good hip is more difficult than my hip that was operated on. It relieves the pain that much. Okay, hamstring stretch. We're going to use this strap. We're going to put it around our foot, and we are going to keep the leg straight, and as long as you can tolerate it, you're going to be pulling back all you can on your leg. Do that to both legs, and that stretches your hamstring. Now we're going to get on our stomach, and stretch the quads. And I'm going to pull my leg back all that I can. I'll get rid of that. Next is the clamshell action. I am going to wrap a stretch band around my knees, just like wrapping a Christmas present. And I'm going to get on my side. My knees are bent, and I'm going to be raising them all I can. And again, 10, 20, 30 times. They're going to say like 2 or 3 sets of 10 reps. Whatever you can just do in 10 reps, and then rest a little bit and do it over. Okay, I've done that on both sides. I'm going to release this. I'm going to be on my side. This knee is bent, this leg is straight, and I'm going to lift this leg. Again, a number of times. Get on your other side, do it there. Next is the crab walk. I'm going to take the band. I'm going to wrap it around my knee, and kind of like a crab, I'm going to be walking side to side for some distance. There's not much room in here, so I can only show you the action. Keep doing that until your legs are tired. Just back and forth, back and forth. Slightly arched, bent over. Okay, the crab walk. A standing stretch. It's hard to show it in here because the camera is not, I can't show. If you're standing next to a wall, both feet on the floor, you're going to reach up as high as you can reach, stretching a little more with one foot than the other. A quad stretch that is fairly famous, like so. These are the basic things. You can get up from a chair if you keep you're going to come forward and keep the curve in your back, not just bending over. So you're keeping your back straight. My hunch is that strengthens your knees. It teaches you good back technique. Okay, these are the basics. A quick testimony. Robin McKenzie was a doctor who became one of the fathers of physical therapy. Many years ago, he had a patient come in with extensive back pain, and McKenzie was busy. He says, okay, lay down on this couch and I'll be back in a few minutes. Instead of laying on the couch with his back arched forward, as you would expect, he was on his stomach, hyperextended. McKenzie came back into the room. He was aghast, and he says, are you okay? And the patient said, the pain is gone. And that was the discovery that became the basis for a number of things in modern physical therapy. Okay, Robin McKenzie's work, you can buy his books, about 10 bucks each, small book, from Amazon. Treat Your Own Back, Treat Your Own Neck, Treat Your Own Knee, let's see, back, neck, shoulder, knee. You can look on YouTube, and I'm told that his works are there also, free. So look that up. I hope the best for you. As I say, I'm not a doctor. I am only giving you what has worked for me And I think it's going to keep a number of people possibly from needing surgery. Hopefully it's going to work for you. Thank you. Bye-bye.